John Sharp, psychologist. I'm a cardiologist, heart doctor. We work in the Heart Transplant Centre for Scotland at the Jubilee. And I'll give you like 2 minutes of an introduction, and then John's going to tell you about learning cafes. So I was fortunate enough about 2 years ago to be an SPSP fellow, and as part of that fellowship, they got this chap called Göran Henriks to come from Sweden and talk to us about initiatives, patient-centered initiatives that were being led or undertaken in Sweden. And he told us about a lot of interesting things, but the thing that really captured my imagination were these things called learning cafes. So there's a lady in Sweden called Annette Nielsen, and she's been doing these things for several years. And the whole concept that underpins them is that patients are best at teaching patients about experiences, about their illnesses. So the current model really, in my mind, is doctor tells patient about bypass operation, doctor tells patient about heart transplant. But actually, who would be best to tell the patient about heart transplant? A patient who's just had a heart transplant. And so that really appealed to me. And so I came back to Glasgow and then met up with Annette Nielsen in London and then in Sweden. And she gave us enough kind of grounding to kind of set it up ourselves. So those of you that know me know that I never finish anything that I start. So I passed it over to John Sharp, who really has kind of driven it forward, and I've just watched and sat back and really enjoyed seeing it happen. So I'm going to pass you over to John. Before I pass you over, I said to John, every presentation should have a slide in it that has nothing to do with the presentation. This is the slide.
Okay, doke. So I'm the other John, and you'll know that I'm the psychologist because I'm wearing a cardigan. We've got a nice introduction from John about where this all came from. And before I started at the Jubilee, I didn't really have any exposure to the world of improvement, and John's influence has really been inspirational in terms of motivating me to take a step back and look at services and look at different things that we can do to really make things better. And certainly it was apparent that the patient experience as they pass through heart failure, advanced heart failure services and transplantation really was nowhere near as good as it could be or should be. And that's not to say that transplantation, of course, isn't a good thing, and we all know that transplantation is actually an incredible gift that people can give and helps people survive longer and improve their functional status and their general quality of life as well. However, what also goes along with transplant is really a huge psychological burden, and there are any number of different psychological problems that we see in the aftermath of a heart transplant, and that's certainly borne out in the literature as well. And any review of the psychological consequences or sequelae of transplant will tell you that there are huge prevalence of anxiety and depression, and something like depression in the post-heart transplant population is up to or exceeds 1/4 of all patients have clinically significant levels of depression. So despite the fact that they've had this amazing surgery and treatment, their quality of life and their mood state is often really poor indeed. And part of my job is to try to address that and to try to make people feel better and overcome things like depression and anxiety, because they can have a huge consequence, not just in terms of how people feel, but also in terms of their health care and going forward. They've got worse prognosis, their functioning isn't as good, they're more likely to be rehospitalized, and they've got an increased risk of mortality. So depression is an independent risk factor for all of these things. So it's absolutely crucial that we try to do something about it. And my outpatient clinics at the Jubilee are full of patients with advanced heart failure or who have been transplanted. And I'm trying to trying to treat that using psychological therapies. But it did occur to me that actually maybe what would be more helpful in a lot of regards is that instead of being reactive and waiting until people become depressed before we start to treat it, is that we try to improve patients' experience so that they don't, or we minimize the chances of them becoming depressed in the first place. And so we started looking around at the literature again, and what that really revealed was some of the things that predict whether people will become depressed and make it more likely that they will do so. And the things that emerged really were this notion of how much support they have. And we know that things like social support and peer support are incredibly protective. And this nice review paper summarised it well, saying that psychological well-being for post-heart transplant patients may be improved by facilitating access to social support from other heart transplant recipients. Now, that's something that we do to some extent within the Jubilee, but we don't do it deliberately and we don't do it systematically, and we could certainly do that better. So how do we go about doing that? Well, the first thing is to move away from this idea of being reactive and looking at what is wrong with people and trying to help them in that way. And this shift in philosophy from moving from what's the matter with you to what matters to you was really fundamental in guiding the development of our Learning Cafe. So how did we go about doing that? Well, I'm going to talk about what the Learning Cafe is involved, but in the breakout session that we do. But before we do that, then it's worth going through the process by which we took to get to the point of forming them. And I enthusiastically jumped into the world of improvement and crossed all the T's and dotted all the I's, and wanted to do this really thoroughly and properly. So we did things like improvement charters, we did driver diagrams, we looked at the model of improvement with which you'll all be familiar, and with all its nice arrows and circles and so on and so forth. And to be frank, once you immerse yourself in all of these diagrams and the jargon that goes along with improvement, it gives you some kind of a headache. And this is the situation that I ended up in, was really almost feeling overwhelmed by the amount that is out there and trying to piece together what we needed to be doing and how we needed to do that. And it's really at this point that I turned to John Payne, who's an improvement fellow, and really he inspired me by giving me a dirty big kiss. And by that, I mean that he told me or emphasized the value of keeping it simple, stupid. And by that, what he meant was he went to focus on what we're actually trying to accomplish. And what we're trying to accomplish was to facilitate peer support and what that actually meant for people. To avoid getting bogged down in too many details. And it is very clear that from a bureaucratic point of view, it could have been an absolute nightmare just to organise a simple meeting. And to adopt the Nike mantra of just do it and get on with it. He actually said just effing do it, but I thought that might be too rude to put in a slide. So we did, and we got on with it. And as I say, I'll talk at the breakout session about what the Learning Cafe actually is and involves and looks like. But we now have this up and running, and it's been a tremendous success. And we have monthly meetings for patients who come in and have their coffee and have their cakes and have a fantastic time and getting huge value out of their peer support opportunities. And of course, what integral to the improvement methodology is the need to measure things, and we've done lots of different measures in an effort to try and understand the impact of it and whether it's actually working, whether it's a good thing or not. But going back to this whole notion of the value and keeping it simple, when we met with John to discuss these slides, I flippantly said maybe these outcomes are all well and good, but maybe actually the best outcome that we've got is the most simple one, which is how many cakes we've got left at the end of our meeting. Because every meeting we've had so far, we've always got loads and loads of cakes left. And that, to me, suggests that people are so busy and involved and immersed in the group and talking and so on, that they're too busy to get their chops around the shortbread. So that again is the value of the simplicity. And just to re-emphasize that, we've got this focus on, did it work? Did it work? What difference is it making? Is it effective? And so on. And again, perhaps sometimes the most valuable question isn't whether it worked, but how it worked as well. And the way that we've been establishing that is simply going back to a theme that was mentioned earlier, is by listening to our patients and participants within this group. And we've got loads of great sound bites that they've generated from this. People talking about the reassurance that they gain from speaking with other patients. People talking about the value of the shared experience and speaking to someone who's been through the same as them, and simply being able to talk and having the opportunity to do so. So the one thing that I wanted to get across within this short talk was just the value of trying to get back to basics, of trying to remind yourself what it is you're trying to accomplish and what the easiest way to do that is, and not be intimidated or overwhelmed or put off by having to follow prescribed models and arrows and boxes and so on and so forth.